Hey Muluvinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host Alex Lavilati. A massive thank you to everyone that have been following our social media sites, and especially right here on our YouTube channel. A massive Nakavaka level for the subscriptions, the likes, and the follows. Today we've got a very special guest, and with us here in studio, our very own nursing educator here at Oceania Hospitals, Amelia Wara. Muluvinaka, Amelia, welcome to the show. How are you?
Muluvinaka, Alex. Feeling good.
Thank you. Recently, and this goes out to the viewers, for those of you that follow our page on the Meet Out Team feature, Amelia recently shared, that your role is centered around enhancing patient care through professional development. Can you walk us through what a typical day looks like for you as a nursing educator at Oceania Hospitals? But before we jump into that, could you just introduce yourself?
Thank you, Vinaka, Alex. Well, I'm Amelia. I'm the nurse educator here at Oceania Hospitals, and I have 28 years of nursing experience. I've worked all around Fiji at subdivisional level. I've worked in the tourism industry, did a bit of research with Ministry of Health, and most of my career was spent in eye. So I believe I've done special training, and I'm a trained eye nurse. And not only that, my other experience is I worked for quite a while with an NGO, Pacific Eye Institute, which is funded by Fred Hollows Foundation, New Zealand. It's based at Brown Street. So when I was there, I worked as a eye nurse, an outreach nurse, and my last role before I joined Oceania, I was the regional workforce support manager for the Pacific, whereby I looked after trained eye nurses in the Pacific region, and whatever I do there is somehow related to what I'm doing here in Oceania. So it's training, mentoring, and coaching.
Thank you. You mentioned coaching and training. Can you walk us through what a typical day looks like here at Oceania Hospital for you as a nursing educator?
Thank you for your question, Alex. Okay, for me, if I will have to go over my schedule in a week, 4 days I work in the ward. I work closely with nurses, and we also have enrolled nurses here, and we are proud to say that we have the first cohort of enrolled nurses here that we recruited back in November. And like I said, I mentor and coach, and I also train. So it's not only nursing care, it's from providing quality customer service to our patients, which is just after handover, just going to the patients and saying, Bulavinaka, hello, my name is so-and-so, I'll be your nurse for today. Okay? And introducing themselves and going over all the other things that the nurse is supposed to ensure that they do in their 8-hour shift, which is medication. Okay? It's very important that when they give medication, they make sure that they follow the rights, and these nurses know, because we also have enrolled nurses. So enrolled nurses, we are training them, because these enrolled nurses, they will go back and complete their bachelor's in nursing. So that's where my role comes in, and it's very important that I groom, train, and mentor them, because after they complete working here, should they go and complete their bachelor's in nursing, they know how to look after a patient and to be able to give good quality patient care. Yeah, so that's basically what I do every day.
Thank you. That's quite an insight into your day. You mentioned mentoring and advocating for nurses and enrolled nurses and nurse assistants.
Yeah.
What are some of the biggest challenges that you've encountered in ensuring quality standards, and how have you overcome them?
Okay, thank you for that, Alex. Not all patients are happy when they're in the hospital. as much as we want to make sure that they are happy while they're admitted, at the same time, there are some things that will make them disappointed. So that's where I come in. Yeah. Well, disappointed patients, and they're not happy when things like, linen's not changed. Okay, and for that, I involve housekeeping department. Okay, when there are meals. Okay, because it's us nurses. We are the ones that are there with the patients full time.
That's true, and it's quite interesting, and it's also reassuring to our viewers, that you spoke about fostering a culture of continuous learning and teamwork, and I believe that has inspired the team, and it's basically a tool or a program that have been found most effective, and that, ladies and gentlemen, is something that we work with behind the scenes in terms of providing exceptional clinical services with the nursing team, and working alongside Amelia is Mr. Chonetani Rokowa, who we had on our previous episode, and this basically is a team that's working behind the scenes and making sure that everything goes well is Amelia, in terms of fostering a culture of continuous learning and that teamwork. And just before we wrap up, looking ahead, what are your hopes or plans for the future of nursing education and practice here at Oceania hospitals, and especially in a rapidly evolving healthcare landscape?
Thank you, Alex. For me, I would like to see nurses more into training. That's something that I'm always emphasizing to these nurses. And like for me, I've grown the professional ladder from being just a nurse like them, and I'm now an educator. And I try to empower them not to stay as nurses until they retire, and they can go out and do other things. And not to be disheartened if things happen in the workplace, because there are constraints, there are things that nurses face every day in the workplace. But we are fortunate here at Oceania, we don't have shortage of consumables. We work in a hospital that is much different from the public sector, and who else will be tired? It's us nurses again. Yeah. So I want these nurses to have that passion. Nursing is a art, it's a calling, and I always emphasize this to these nurses. We are recruiting a lot of nurses, but it's rare to find nurses that have that passion. It should come from within. To me, coming in the morning just saying, "Hi Alex, how are you?" It brightens up your day. It puts a smile on your face. And that worry, that high blood pressure will just drop. So to me, I always emphasize it, and I tell them, just going in the morning and telling your patients, "Hi, hello," and this is what I want to see to the new nursing graduates now. It's not about the money, it's about the passion. You have to have that passion within you. And that's what I want to see with our nurses now. So that's what I keep emphasizing to our nurses here at Oceania Hospital. And be professional. Okay? And they should be good role models, because we are having nurses that are joining us, and they have between 3 to 5 years experience, and they look up to these nurses. Yeah, and to continue studying. It doesn't mean that they've worked for 15, 20 years and they stop there. So that's what I would say to the nursing cadre here.
Thank you. Thank you very much, Amelia. And just to add on to that, there's a Chinese proverb that goes, find a job you love and you will never work a day in your life. You need to be passionate about it, and it will clearly show in the work that you do. And thank you very much, Amelia, for taking out your time. And that, ladies and gentlemen, is just a brief insight of what our nursing educator does here at Oceania Hospitals, and it's just to give you a fair idea of how things operate behind the scene. So until next time, right here on Health Talk with Oceania Hospitals, Naka.